Michael Goldberg. I am the scholar in residence at the Schwartz Center for Compassionate Healthcare. And I want to welcome you all to our Compassion in Action webinar series. Today, we're going to have a workshop that's practical and functional, and it's called Wounded Healers, Reflective Writing, Personal Resilience, and Culture of Compassion. And it will be led by Dr. Maureen Mayhew. She's filled various roles at the University of British Columbia in family practice and in mind-body medicine, and currently focuses on physician well-being, coaching, education, and describes herself as a wounded healer. So, Maureen, it's all yours.
Okay, well, thank you for the introduction, and it's really a pleasure for me to be here to lead you in a workshop and just to be surrounded by such compassionate people. The idea with this workshop is to explore the wounded healer concept as we relate to it, and to really pick out the power within it as opposed to the weakness or the loss or that kind of thing. And so I'm just going to pull up my slides and share my screen. So just give me a second. And wait, give me a sec. So I think everyone can see that slide, right, Michael? So the idea here is to have is to explore the wounded healer concept through using reflective writing, guided imagery, and what we want to create really or foster is personal resilience and a culture of compassion wherever we go. And I did this body of work with two other individuals, Jean Berater and Liz Lawrence, who can't be with me today, so I just thought I'd give them credit. So I'm hoping by the end of this workshop that you'll be able to appreciate the wounded healer as a useful concept, and to use guided imagery and reflective writing in your own work, for yourselves and also for any clients or patients. And then the other piece is also to practice self-compassion and supportive feedback, which we'll do in groups of 4 as a practice kind of session. And all of this is going to be linked together. So the workshop format is about 10 minutes of me introducing concepts and evidence and that kind of thing, and then about 20 minutes of guided imagery and reflective writing. And then we'll move into breakout rooms of where you're going to be 4 to a room. And then we've got a large group discussion where hopefully you'll feel comfortable sharing some of the learning and maybe a goal that you have set for yourself. When you do go out into the breakout rooms, we ask that the videos are turned on because that helps with the active listening part. You need to see people to deal with, to really truly see body language. So this slide is really about stress in healthcare, and I know that there's a variety of healthcare workers out in the audience. And what we know about chronic stress in itself, irrespective of where it comes from, is that it's associated with a variety of conditions like burnout and PTSD, and even immunologic function is affected, anxiety, depression, loneliness, even chronic disease outcomes can be related to levels of stress and how we cope with them. So the wounded healer concept is not new. You know, if we think back in time, we know that it's been in all sorts of different kinds of belief systems. The wounded healer archetype, as I understand it, I think it emerged from the ancient Greeks with the myth of Chiron, who was immortal and wounded and rejected and by his parents apparently, and he became really a knowledgeable medical or medicine man, if you will, and a healer, and that's the first that I'd heard of it. The you know, of course, Christianity it has Jesus as God's wounded healer, and then we've also got shamanism has a wounded healer archetype in it, where the shaman himself or herself is a wounded is wounded and healing as they heal others, and in that process they become a visionary and a healer and a seer. And in some kinds of shamanism, there's self-inflicted wounds as well, which promote the healing process. And then there's Carl Jung. And I love this quote. It's the doctor is effective only when he himself is affected. Only the wounded physician heals. Of course, in this day and age, we wouldn't just say he himself, but that was Carl Jung a long time ago. He died when I was born in 1961. So, and then if we move on to Buddhist teaching, this is Pema Chodron in her book, The Places That Scare You. Compassion is not a relationship between the healer and the wounded. It's a relationship between equals. Only when we know our own darkness well can we be present with the darkness of others. Compassion becomes real when we recognize our shared humanity. And when I think about that, I spent a decade going to Afghanistan to do humanitarian work, and it was the only place that I noted on my initial application that I did not want to go. But I went, and what kept me going back was the shared humanity that I saw and that I shared with those people. And this is a quote from Rumi, the Jalaluddin Rumi, the Persian poet. The wound is the place where the light enters you, which I love that idea. So what about traumas in healthcare? If I look at these slides, these are just to conjure up images for you. So the one with the boxes on his back, that's the one that I relate to. And I think I would say, you know, I've been in practice for over 30 years. And what I felt was that I was just so overwhelmed by all these stories that I was carrying on my back. And like I had this ginormous bag and burden that I dragged around. And it came to a point where I just emotionally shut down, and I just no longer could relate to the patients the way that I wanted to. And so I needed to step back and learn how to reconnect to my own emotions. And that's what led me on a different path from the path that I initially started on, which was remote medical care. But you know, the kinds of losses or traumas or stressors that you might notice in healthcare might be medical errors. You know, big medical errors in the physicians I work with cause huge strife, and some people quit practice after they have that kind of thing. Some people lose a license. Our culture in medicine is um, not very accepting of errors, and 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 we tend to judge a lot, and that can lead to people feeling very lonely in their solitude and their suffering. Um, and you know, there's also emergency room kinds of work, or other kinds of work where you're physically involved in trying to resuscitate a patient, say through external cardiac massage or something. A friend of mine did that, was talking about that one time, and then she walked away and just was haunted by this image of her hand squeezing this heart. Um, and then there's the people who feel like they've got a target on their back, like they're not supported, like administration is out to get them because they're just not doing things the way, you know, maybe they're a bit of an entrepreneur, and they're in a bureaucracy that is not tolerant of that kind of thing, and how can they behave? So there's all sorts of traumas that we can experience. So if we look at narrative reflection really is about exploring our own stories. And Brené Brown has this wonderful quote: owning our own story and loving ourselves through that process is the bravest thing we'll ever do. And in case you don't know, Brené Brown is a social worker in the University of Texas. And so if we look at reflection as a practice, what's the evidence for it? Well, we know that if patients who do repeat regular reflection in writing, they often in some of the studies, it's been shown that they have improvement in symptoms, particularly asthma and rheumatoid arthritis were studied. There have been reduced numbers of self-reported symptoms of distress. There's been improvement in immune function, such as CD4 counts and viral loads. As well as hepatitis B has been improved also. There's also a reduction in symptoms of anxiety, and such as high pulse rate or skin conductivity. And so those have been studied and compared in different cohorts. In terms of healthcare workers, both trainees and physicians, practicing physicians, have been studied. And what has been shown is an improvement in self-reported well-being, empathy, kindness, less burnout, and also more groundedness in their professional identity, and less imposter syndrome. Again, the imposter syndrome is a syndrome that we see a lot of both in trainees and in early career physicians, as well as other healthcare workers. And those studies all involved written reflection. And then if we look at guided imagery, we know that guided imagery, there have been studies that have looked at surgical outcomes, chemotherapy outcomes, chronic pain outcomes, anxiety, depression, and PTSD, and have found benefit in using guided imagery. And of course, guided imagery is also used in sports and athletes who want to compete. It's also used in people who present to get over their own anxiety in that. And so now I invite you all to a guided imagery. And so this is going to take about 10 minutes. And then after that, we're going to get you to write. So I invite you to find a comfortable position. If you'd like to sit on the floor or lie down, please do so. Just turn your camera off. If you're seated in the chair, maybe put your feet firmly on the ground and rest your hands on your thighs. Maybe you're feeling connected to the earth that way. Now take a deep breath in through your nose, feeling the air pass through your nostrils, down the back of your throat, deep into your lungs and into your belly. And as you exhale, imagine any tension you feel releasing with the breath. With the next inhale, note which muscles feel tight and imagine the breath massaging them, relaxing them on the exhale. I invite you to close your eyes. The experience is deeper if you do. If you prefer not to, perhaps look at your hands and keep breathing gently and deeply. Let yourself become heavy in the chair or on the floor while you listen to the rhythm of your breath. When you take your next deep breath in, I invite you to let your imagination go. Let it take you to a place that is completely safe. It can be real or imagined. If you choose a real place, add any details you want. Anything you dream up is perfect. As you imagine this safe space, look around. Whatever you see, imagine, or sense is exactly as it should be. Wherever you are, notice what the colors are, the sounds, the textures. Maybe there's a scent. Do you want to touch something? What does it feel like? Let the image become so alive you can almost taste it. Now, find a place in this safe space to be with your memories. You can take a walk, sit somewhere comfortable, or lie down. Do whatever feels right. As you do that, I invite you to recall a loss or an experience from your practice that still affects you. You may have lost a patient, made a mistake, had a bad outcome, had a bad experience, or even lost yourself somewhere along the way. If more than one image comes to mind, just pick one. It doesn't matter which. Just hold that memory gently and let your imagination explore it. Note what emotion arises. Where does that emotion live in your body? What do you feel? How do you speak to yourself about this memory? With kindness? With judgment? Or something else? Now place a hand on your heart and breathe in compassion. As you breathe, allow compassion to expand all the way to the tips of your fingers and the tips of your toes. What awakens in you? Whatever arises, cradle it gently. And imagine any judgment unraveling from your body, from your mind. Then let it go. With the next breath, breathe in loving kindness. Let kindness flow into your body, gently expanding with each breath. Allow any critical thoughts to leave when you exhale. Let's do that again. Let kindness flow into your body, gently expanding with each breath. What shifts inside you? What is possible from here? And now we bring this moment to a close. As you breathe in I invite you to return to this place, to this time. With the next breath, trust that you'll remember what you need to remember. And with the next breath, open your eyes, stretch, and I invite you to write. And the exercise with writing is to keep your pen on the paper. Don't edit, don't criticize, just write about the experience. We don't care about grammar or spelling. And if you're stuck, write and or but or so or I don't know what to write, and something will come to you. And just trust that it will come. We have 10 minutes for this, and so I'm going to time you, and then and if anyone has any questions, you can certainly ask us in the chat. But really what I asked you to do is write from the heart, from the experience that you just had. If you're a little stuck in terms of what to write, I've given you some prompts on the screen, but you don't even have to look at the screen. So the assignment for those of you just joining is to write about your experience from the guided imagery that we just did. For anyone who didn't, who just joined and wasn't able to hear the guided imagery, I'd ask you to write about the experience of bringing compassion to yourself in the experience of a loss or a mistake or some kind of experience that you've had in your practice that you found troubling. Okay, so now we're going to go into breakout rooms. I invite you to finish your sentence, and then we're heading out into breakout rooms. And so that's just a random assignment, and Karen is going to put you into breakout rooms. You're going to be 4 per breakout room, and really the idea of this is that you're going to each have about 4 minutes, 3 or 4 minutes to speak. And then the listeners, as the speaker, you share what's comfortable, and any listeners are going to actively listen, which means listening to the words, the body language, the tone, noting any hesitation, listening kind of between the words, if you can look at it that way. And the supportive feedback that the listener provides is really to help the speaker go a little bit deeper into the experience. So asking questions, using your intuition, avoid why statements or why questions, and please don't share any judgment. The judgment shuts down compassion and learning oftentimes. And so with that, I'd ask you to put your videos on so you can actually see each other, and you have a few minutes each. We'd planned on 4. Just getting a chat, and I'm just checking that out. I know some, and people who don't have a camera or a mic, they can respond by chatting, and that's the best that we can do in that situation. But so 4 minutes each, that'll be 16 minutes total, and you'll get a 1-minute warning. And with that, it's time to go in the breakout rooms. Okay, so now we're back in the large group session, and I invite you to share any learning that you had, what shifted perhaps, if anything, what helped the most for you, or the personal goal that you'd like to bring forward to practice either in your life or in the in your organization or at work. And of course, any questions or comments would be appreciated as well. And we may, if someone has something and that they'd really like to talk about, we can also invite them to unmute. And with that, I'm going to stop sharing my screen. So anyone like to share anything?
This is Karen. Can you hear me? Just to confirm before I continue speaking.
Yes.
I would say perhaps I'm the least equipped, but I was not able to join the earlier part of the session, but did participate in our group, and everyone spoke. And in their speaking, I recognized and what they were sharing about their individual experiences. I'm recognizing that I am bottled up. That expression that was shown on the screen about being soft and strong. I've recognized this many years into my career as a pediatrician who has processed the death and transition of so many children. I've never stopped to really manage a lot of that pain. I'm a little bit too far on the strong side, clearly, and in this moment, I acknowledge I have some work to do. So that's what I was at least able to share with the group before we transitioned. Just wanted to state that.
Well, thank you for sharing that. And, many of us, I think, share this similar kind of sentiment, right? Of being a little too hard on the outside. I certainly did at one point. Yeah. Anyone else? Anything shift? Any goals you want to share?
Maureen, I don't know if you noted there was a comment that there are times when it's okay not to be okay.
Yes. And it's so true. It's okay not to be okay. We don't always have to be so strong. If we are strong all the time, then we end up bottling up and not expressing ourselves, and maybe disconnecting, as I did. And so I think it's really important to be okay with not being okay, and allowing that to just kind of process it. And I do think that some sort of reflective practice can be really helpful, and particularly if it's shared. If some people like to have a buddy to do this kind of work. Yeah, and then Scotty says, I often feel like I'm moving on to new patient assessments without any time to process the previous ones. And the experience that I had. And that's so true of the kind of medical practice that many of us, or medical or other practice that many of us have landed into. Often we'd like to process, but we don't have the time. So how do we do that? And there's different ways that you can do that. One way is to set aside some time to reflect. sometimes it can just be as little as 5 minutes to reflect. And of course, I know that everyone's time challenged, but it is important work. And for longevity in practice, it's also important too, right?
And there was another comment in the chat line, which speak about how do you remove the judgmental self on your shoulder and replace it with the self that has open arms and a big heart.
Yeah, the one that'll hug you.
Yes.
Yeah. And the judgy part of ourselves, that judgment, the inner judge, the inner critic, or the saboteur in coaching speak, has been really helpful to us for part of our lives, right? And for certain kinds of things, it's been really helpful to us. And so how do we harness the way that it's helped us, yet not allow it to take over our lives, and allow ourselves to foster the hugging side, if you will? Yeah. And it's a balance. But a lot of us are conditioned to listen to the judge voice. Yeah. And there's we are all experiencing loss and tend to minimize our losses when comparing our situations to others. So there's that tendency to compare, and when we compare our experiences to others, and well, it's not so bad, I shouldn't feel this way, all that kind of stuff. Well, the thing is, I feel this way right now, and that should be okay. And if I acknowledge that feeling, we know that it unravels, it floats away, right? It doesn't last forever. But acknowledging it is important. And working through losses is important too. And then someone else wrote, especially for those young in practice, to know that they're not the only one with emotions and reactions, right? Like the old guys and the old girls and guys, maybe they became so stoic, and these young ones are so emotional. And how do you marry that? And that brings up the culture of medicine, and how do we shift that culture to one of compassion as opposed to one of judgment and perfection. And somebody and Melissa wrote, it's good that we have two shoulders. We can have the hug side on one side, and the judge on the other, and we can kind of bring one up and then bring the other one up when we need that one. And if we can think of it as a dynamic approach, then that can be helpful. I noticed that we're really at time now, so I just wanted to leave you with a poem that I love and that has helped me. So it's called Love After Love by Derek Wolcott. The time will come when with elation you greet yourself arriving at your own door, in your own mirror, and each will smile at the other's welcome and say, sit, eat. You will love again the stranger who was yourself. Give wine, give bread, give back your heart to itself, to the stranger who has loved you all your life, whom you have ignored for another, who knows you by heart. Take down the love letters from the bookshelf, the photos, the desperate notes. Peel your own image from the mirror. Sit and feast on your life.
Well, I am afraid the time has come. Thank you so much, Maureen, for helping us heal and for finding ways we can continue healing. It's a gift. I want to thank you all for being here, to thank our national business members for their support. There will be a recap of the session that'll come to everyone, and with it will be the link to use to claim your continuing education credits. Next time we get together will be on Monday, September 14th at noon Eastern Time, where there'll be a conversation on compassion and human experience with Jason Wolf, the president and CEO of the Beryl Institute, and with Beth Lown, the chief medical officer here at the Schwartz Center. So until we're together again, I wish you all well, a peaceful and restorative weekend, and bye-bye.